Malaysia, when we have a population of 33 million population, and out of that, about 40% are workers. So we have almost 15 million workers, right? So 15 million workers, and you know, I don't have a data how many of them actually have gone through this treatment or even had cancer in their life, right? So anyway, so our main area here today, I'll be talking on the what will be the impact on the impact of cancer on the workplace and all that, their work process, right, and even the environment in the workplace and all that. So every cancer, I'm just going to highlight few major cancers. Every cancer will have its impact, and we'll look into that. Identifying the key factors. Here the key factors would be what kind of stage, which stage of cancer, type of cancer, the treatment they receive, and the workplace, the demand, work demand, right? So we're going to look into all that, and the support from the employer. That is very, very important, support from the employer. And the role of occupational health professionals here. Well, not many occupational professionals actually are involved in Malaysia in managing cancers at workplace. But then here, what is the role? Is a very critical, crucial role in bridging between the clinical improvement and the work reintegration. That means back to the work. And in this involves a lot of multidisciplinary collaboration between an occupational physician, HR, human resources, and also those from the hospital like rehab, physiotherapy, oncologists, all that. So it's a teamwork. So we're going to look into all this next. Right? So I'd like to define here, right? Define here how a cancer, right, diagnosis and its treatment can impact a worker's life, right? Physical and mental capacity to perform their job effectively and safely. As it is, right, when those cancer patients, they already undergo a lot of hassles and all that, right? Like fatigue, pain, due to the side effect from the treatment itself. So now, when they are at work, now that will be going to be very difficult, right? So how are we going to put this group of people back to work, right, effectively and safely? This is what I'm going to do. Next. There are main factors here influencing the work capacities and in cancer patients, right? These are some of the factors which influence. Offhand, when I ask someone, what would be the main factor which can influence workers in the workplace, will be, the first thing comes to our mind will be the type of cancer, the stage of cancer. But this only has a moderate impact. The main impact would be the treatment side effect itself. The treatment when a patient receives, right? Later on we'll go into a bit detail into this. So this has a profound effect on the workers, the treatment. The next would be the support from the workplace. Here the support will be from their workers, their colleagues, or even the employer. Mainly will be support here. The other impact which has on the workers would be the work demand. Here work demand would be, some of them will be working shift worker. Probably as a laborer, manual laborer. Sometimes they work in an office where they have to use a lot of thinking. They have to do a lot of thinking and all that. High cognitive load and all that. So that also has impact. So we will look into all this for mainly on the treatment and the support from the employee in the workplace. Thanks. Right. So let's look into some of the common cancers here and the impact on the workers. Let's look into the breast cancer, which has been mentioned in the first plenary before we had our tea break and all that. We were mentioning about this. Right. Here, these are the, I'm not going to go into the medical aspect of it. My concern will be the work effect. What will be the impact those who have underwent treatment and all that. Breast cancer, it will impact the physical and cognitive roles of the workers here. Impact in the work, right? So fatigue, and you can even see some cognitive changes. So now, talking about cognitive, what is cognitive changes would be more on difficult in concentration, unable to remember, right? So that will be the impact on that. For those with lung cancer, right, usually will be diagnosed at later stage, right? They will have pain, chest pain, respiratory issues and all that. These are the complaints the workers will complain. And the work effect will be very limited or restricted return to work. Our main concern here is put them back to work. That's what we call return to work program, and that limits that. So it's going to be very, very challenging to put back the workers to the work. Okay, next. Prostate cancer. Okay, that's another condition where involves a majority of, mainly men, right? Older working men here, right? The side effects, they will have all these issues, urinary issues and all that. And what will be the impact in the workplace would be the concentration, right? Concentration. Again, here we have to do a modified return to work. Here, the modified return to work will be tailor-made. You don't have a common return to work, right? Every worker who has cancer has completed his treatment and is going to go back to work, right? So you do a lot of return to work program, and it will be a very tailored made here, right? So you got to look into all this. Next will be colorectal cancer, right? I understand that this is also rising, right? Cases of colorectal cancer among the workers, it's going up. Here, what the issues they will face will be after surgical, post-surgical recovery, mainly on their stomach care. You know, the stomach back and all that, they'll have these problems. So the issues they will face will be, they will have very difficult limit in their mobility, in their movement, right? And sometimes they need a lot of help and support at the workplace. We will look into this later, detail. Yeah. So the physical impact, right? What would be the physical impact on the treatment? Remember earlier I mentioned about the factors which are going to influence workers in the workplace. The main profoundly or main factors which will impact the workers, right, would be the treatment, right? The treatment and the side effect. These are some of the treatments. I know earlier they have mentioned a lot of latest treatment, which first time I'm hearing that. But here, these are the common ones, right? The common treatment for cancer. Chemotherapy. I think chemotherapy is among one of the commonest here. Chemotherapy, those who have underwent chemotherapy, the workers, this will be the side effect. This is very important for us, for an occupational doctor or occupational practitioners, like safety and health officer, even the employer in the workplace, to understand this. When the workers come back, you can't expect them to be 100% as they were before, right? They will have fatigue, nausea. There also is a condition known as chemo brain, which I'll explain later, right? So this will be the physical side effect. So what will happen in the workplace is reduced stamina, and you will have dexterity. Here will be the loss of task, right? They have to work their hands and fingers and all that. They will have all these issues. They will have some problem here, including their cognitive speed, right? So those who underwent chemotherapy. With radiation therapy, again, here they will have, when you have radiation, right, so you'll have skin reaction, some organ toxicity on the workers and all that. So when the workers are back to work, they will have these complaints: pain, discomfort, reduced mobility, and also weakness. So we need to understand this, right? Those who underwent surgery, again, lifting. So imagine it's a manual worker. He's a manual worker, blue-collar worker, and he's back to work. What are you going to do with him? Because he will have some problems here. He can't lift like before. Or he can't push things. He can't work as like he was before. We can't terminate everybody because we have laws in Malaysia. I'll show you later. Right? So lifting will be a problem here, restricted. The hormonal therapy, right? The workers will complain with hot flashes, joint pain, fatigue and all that. Here, again, because when they have these symptoms and they're back to work after the treatment, you're going to have all these problems, like concentrating and putting in 100% effort at the workplace. Immunotherapy again will have some physical discomfort and all that for the workers. Talking about the mental, earlier we saw the physical, the mental part. This is one thing that we always miss for the workers in the workplace, the mental part, right? Because the worker, the employer, mainly those at the workplace, they expect the workers to come back and work as used to be before, immediately, right? They say you have already completed your treatment, you already been discharged, there's no more follow-up, you have recovered, you are fine, right? So you are expected to work like any other person here. But we forget and we ignore that they undergo all these mental health and cognitive impact in the workplace. Anxiety is one of them. Why the person anxiety is when they start, they know they want to work, but they will have this problem of focusing on decision making and all that, especially if they are in a position where they have to make decisions. So they have all these issues like even confidence in the workplace. Depression is another one. This has been actually, you can't see this much, right? You can't see this much, but they actually have problems like absenteeism, reduced in engagement, and it's always been underdiagnosed in a cancer patient, right? Depression. Adjustment disorders, this is also quite common, right? After the treatment, when they're back here, for them to have again, to integrate themselves into the work, right? They will have emotional outbreaks and all that. Okay, so how are you going to address all this? These are all the problems that they will have under the mental and the cognitive impact. Alright, this is what I meant earlier about the chemo brain, right? Chemo brain, this is the term used of cancer-related cognitive impairment, right? There will be four important things here, where the cognitive will impact will cause challenges in high responsibility roles here. Right? Probably these are the group of people where they have to make decisions. For example, those who work in the, say, quality control. The person has to work in quality control. That means his decision is very, very important to say whether this is good quality or not quality. Okay, QC in industries and all that. And that is a very high cognitive load for him. Right? He really have to put in a lot of thinking and all that. Okay, he has to make a very big decision. Right? If he makes a mistake, that will be a big loss for the industries, right? So here, even a low impairment, right, low cognitive impairment can impact this decision, right? So next will be the errors. They will start making a lot of errors. When you compare before the treatment and after the treatment, there will be a lot of errors made here. Okay? So this is because of the high cognitive impairment. Mental fatigue. Okay, so that will be also another consequences because of the cancer-related cognitive impairment, right? And next will be the difficult in concentrating. So, if it's a manual worker, they don't use they use more on their manual labor, more physical rather than their mental thinking and all that. So here it will be start impacting. They can't concentrate on the workplace. So this is what is known as chemo due to the chemotherapy. And this has been proven here. So what can we do? An occupational doctor or a safety officer, an occupational practitioner in the workplace, mainly we want to do workplace accommodation or modification, right? Whatever term you use, it's not light duty. So that's the problem. Here, they give light duty slip for a couple of months and all that. Right, 2 months, 3 months, and all that. When a worker receives a light duty, say from the treating doctor, and he submits the light duty to the employer he doesn't know what to do with the light duty slip. Right? So he probably just asked for the workers just to sit for a while for 1 or 2 days. Next day he said, you have to start working. Because he doesn't know what to do with light duty. So the term used should be work accommodation in the workplace. Right? Work accommodation or modification in the workplace knowledge. Right? Let's look into some of the cancer type like breast cancer. Breast cancer, right? What will be the accommodation here is, say he's a laborer or manual worker, we will try to reduce the physical task. Now, how we going to reduce the physical task is, we actually reintroduce him back to work in a phase form. That means, for example, he used to carry 30 kilos at average, right? An hour he carries 30 kilos, manual worker. So you don't allow him to carry 30 kilos in the beginning, right? Slowly introduce him, maybe 5 kilos, less than 5 kilos, and then you monitor him after 2 weeks whether he can able to carry more. Then gradually you have to increase if that's possible. If it's not possible, then it will be a job transfer. There are many stages that we will see. This is what is known as ergonomic modification. That means the way you carry. Probably he was loading it manually, carry it manually. Now maybe we can help him by giving him a trolley or even support him with the other workers and all that. Okay, so this will be the phase written. Next will be the lung cancer, right? Lung cancer is quite difficult. compared to the breast cancer. Here, preferably flexible hours. Flexible hours, remote, working remotely, if possible, if the person can work from home. And all that. Colorectal cancer, I think we all understand because of the stoma bag and all that. Alright, although it's written here private restroom, I think that's quite impossible to have his own restroom and all that. But he might need frequent breaks, right, to go use the toilet and all that. Okay, and then the brain tumor here, the brain tumor, right? So here again, reduce workload if possible to simplify the task and all that. Okay, and here these are the hematological cancers, again to have a remote work or restricted work and all that. So these are some of the strategies. I'll be repeating certain things, especially on work accommodation, what is supposed to do, flexibility and remote work. All right, flexible, physical and mental health support. Then you have communication. All right, you need to communicate. That means the workers, we in the workplace, we communicate with the workers, explain this to them and all that, and tell them the awareness that there are a lot of support in the workplace for them, as much as we could. Okay, and to have a return to work program for them. Next. Okay. So you can see here, it's a bit detailed here on the importance of workplace, on the sick leave. If they have to get longer MC if possible, that's fine. But at the same time, you want to have them to improve on their return to work and all that. So flexible schedules, right? So if, for example, a person with colorectal cancer who underwent treatment and all that, you allow them to come to work after the traffic jam, off-peak, to come in a bit late, and probably they can leave a bit earlier. Okay? So these are the flexible schedules. If possible, remote work from home, modified duties, as I mentioned earlier, will be a tailored program for each one, right? Modified duties for the workers and all that, also help them for the mental programs and all that by referring them for counseling or even psychological. And this is what is expected from the employer. So now, who will see them would be people at the ground like us, an occupational physician. We go to the ground and we actually explain this to the workers and all that. Employer, whether if he can provide a health insurance for the workers. This is mentioned earlier in the first plenary. Workplace accommodation, right? Flexible work hours are some of the example of the workplace accommodation and the mental health support. This is what is really, really required for the workers. Next. Right, these are some of the laws. These are the laws for the workers, employees and all that. It doesn't mention anywhere just cancer, it's generally, right? So generally, here, this is the Malaysian law, here Employment Act, it's mainly on the leave they can take and all that. That means the employer can't just simply terminate the workers just because the person has some impairment and all that, right? So this comes under the law. This will be the Persons with Disability Act. This is for those who have prolonged treatment, okay, they have prolonged treatment and they have some kind of impairment. So this will be what we used to call as OKU, right? So they can be given the OKU status and all that comes under this law. And here another law where you can't, the workers cannot be terminated just because of the illness. So these are some of the laws that have in Malaysia. So conclusion here, right? What we do is before even they complain all this, it's good to be proactive. I mean, we need to be proactive. We need to have support at the workplace and all that. It could be a support from the workers, from the middle manager, the line manager, and from the employer. Okay? And we need to understand our role here at the ground, like an occupational doctor, where we are in between the workers and the employer to help them to understand. These are some of the legal obligations. We do help them in this, right? In case they need the terminal stage of cancer for the workers, we also advise them for SOXO, right? The SOXO and all that. Okay, and we work together with other disciplines as well. Okay, just final thoughts. That next, my references, and thank you.